Hey everybody, let me ask you a question. Have you ever heard somebody say to you, or maybe yourself, that once you go to a chiropractor, you always have to go to a chiropractor? Like, how many of you heard that? Like, I hear this every day. So I feel like we need to talk about this because there's such a negative connotation to that. And so this is what I want to do, okay? I want to take this from a non-biased standpoint. I know that might be difficult because I'm a chiropractor and you're probably going to be like, hey, you're a chiropractor, you're going to tell me what you want to do. I'm gonna try to throw some logic, some other examples that have nothing to do with chiropractic, but might make more sense to people, right? Disclaimer, first off, you don't have to do anything you don't want to do, right? Like, nobody's forcing anybody to do anything. Most of the people in my clinic, so I only speak for myself, they choose to continue care even, this is gonna sound crazy, even when they feel great. And I'll tell you why here shortly. But first, let's go over why I hear this all the time. By the way, I'm Dr. Mark Humber with Proactive Chiropractic Group. And so here's the first thing that I want to talk to people about. We've been taught our whole lives that we should, if we're sick and in pain, we should go to a medical doctor, right? And that medical doctor is going to give us some type of medication and it's going to make us feel better. And when we're done feeling better, we don't have to do anything anymore. So I get the mindset of most people that when I feel good, why do I have to continue doing something to feel good? So here we go. Let's throw logic at this. This is going to be crazy, all right? I'm going to ask everybody, I want you to be honest, okay? How many of you deal with, on a day-to-day basis, pain in your teeth? Like every day. Like you're getting pain in your teeth. I would assume most of you don't have pain on in your teeth. Why then do you brush your teeth every day? Twice a day. Wait a minute. Are you trying to be proactive? Are you trying to be, to help not get cavities, gingivitis, other issues in the mouth, right? So when people come and ask me this kind of stuff, I think they're thinking that I'm crazy or that this idea of maintenance when you don't hurt is some out of this world thought process that is so crazy. It's we're just trying to take your money, right? Yet if I asked you that question, most of you would say, yeah, no, I brush my teeth every day because I want to make sure to keep them healthy. And I would agree with you. I think that's fantastic. Now, that's just one, right? So that has nothing to do with chiropractic. Let's do another one. Okay. So say you're somebody who's like, hey, I want to lose some weight. I'm like, cool, awesome, fantastic. What would you most likely, there might be other things that you should do or can do to help you lose weight, but the general consensus is I'm probably going to have to eat better and I'm probably going to have to exercise and move around, right? And so you go through this journey, right? Because it doesn't just happen overnight. So you go through this journey consistently for 2, 3, 4, 5, 6 months, right? And you hit your goal. Now, when you hit your goal, are you allowed to stop? Are you allowed to, well, how about this? I shouldn't even say are you allowed to stop. If you stop, do you keep the weight off? Or over time, does that weight start to gain back? If you stopped eating well and you stopped exercising, most of us would understand that we're probably not going to keep that weight off anymore. We'll probably slowly gain. You're not going to gain it all in one day, though it feels like it sometimes. But you're probably going to gain the weight back, right? So if you want to be a healthier version of yourself and you do want to keep that weight off, what are you going to do? So you've hit your goal, you're probably going to have to maintain it, right? You might not have to eat as much or as good. You can maybe back off a little bit. You might, back off a little bit on the exercising. I don't know, but you're going to maintain it. Okay, so again, same concept. You've hit a goal and now you want to maintain that. And I guess the last one, I don't even know why I'm saying it, but your marriage, right? You're not going to try super hard for 2 years to be the best husband, best wife that you can be, and then get to stop and think that it's just going to maintain that, right? If you want to have the best marriage of your life, it's a journey, right? I guess that's the point I want to get to, is health is a journey. It's not a destination. You don't get to be at this level or this destination and then get to stop and expect that everything's going to stay the same. See, what most people fail to think about is that life, let's just say life's here, recovery's here. This right here is constant. It's every single day there is some stress that builds up from life, whether that's physical or mental. Every day that is constant. Some people can manage it better, other people have a hard time. But key word is manage, meaning it's consistent. You have to consistently work at it, right? But no matter what, every single day brings on its own challenges, okay? Now here, the recovery side, okay? This is intentional. There has to be some intent to do. You can't just hope that you recover. Now, when you're younger, your body runs more efficiently, but still, if you're putting on a ton of stress on your body and you're doing nothing to help your body recover, it will catch up to you, no doubt. So I guess what I'm saying is, when you start chiropractic care or any therapy, it could be stretching, acupuncture, PT, it could be anything, okay? When you start something, what you're really doing is you are taking the stress that you've built up over years and you are now balancing it better. And now you're getting this balance because now you're giving your body some help. You're helping it out through whatever therapy it is. I will use chiropractic in this example. You've brought in chiropractic to help balance your life. So now when you have stressful days, you can drop it down because now you've done a therapy, chiropractic, to help you out, okay? Now, if you were to stop any therapy, whatever it is, guess what stays constant? Life and the daily grind. Everyone, come on. Gotta admit, every day is a grind, especially during a COVID year, political stuff that's happening. We're bombarded by all this information and we're stressed out of our minds, right? So every day brings on a little bit of stress. If you do nothing at all to help your stress out, you're going to start having that kind of overflow where then your body is like, hey, help me out. And what does it do? It produces pain. That is a survival mechanism. It's there to help you realize there's a problem and to fix the problem, not to just feel good. This is going to be for another video. It's not just to feel good and take a pill or medicine or a lotion. That's just a feel good. You didn't fix anything. You're managing something, okay? But either way, what I need people to understand is if you want to be the best version of yourself, whatever that is, we all know that consistency is key. It's doing it and being consistent. This doesn't stop with any therapy, right? How many of you guys have stretched and you're like, dang, I just looked at this stretch online for low back pain and it works so well. And all of a sudden your back feels so much better, but then you stop. And then a couple weeks down the road, a month down the road, you're like, my back's hurting again. And you're like, what the heck? You stopped the therapy that helped you out. Why would you continue to stop it if it's what helped you out? Life is always going to keep being crazy, keep being stressful. You have to do something to balance it. And by the way, the recovery side, just some ideas for people. Here's the thing, nutrition. Most people don't eat well, right? We're one of the fattest countries in the world. Exercise. Most people don't exercise. Goes with being one of the most unhealthy, bigger people in the world. Most people don't get adequate sleep. 6, 7, 8. I would say 7 to 8, but whatever. Let's go 6. Most people don't even get that. Supplementation. Things that helps your body recover better. Are you taking certain supplements? Yes. Are you supposed to get most of your vitamins from your food? Sure. Okay. But I'd even say the way our agriculture is now, we deplete a lot of things with spraying stuff and our soil's depleted. So even then, I still think you should get quite a bit of supplements in you because I don't believe that the food is quite as nutritional as it used to be. It's just my opinion. What else? Those are the main things that I can think of off the top of my head. If you're not getting those on a regular basis, you're probably not helping the stress of the day-to-day grind that you're dealing with every day. And sooner or later, you're going to feel the effects of that. Now, most of you are going to say, well, Dr. Mark, when I turn 40, 50, 60, 70, whatever it is. And I'm going to say that's BS. Can I be honest with you guys? That's BS. Now, for you looking back at me saying, Dr. Mark, wait until you turn 40. Now, I'm going to tell you, you're right, I'm not 40 years old yet. Getting closer, it's getting scary. But the cool thing about my profession, my job, is I get to see and work on people that are older than me. Meaning, when someone comes in and tells me Dr. Mark is just this age thing we put on a pedestal, right? And age does play a role. I'm not going to get, I'm not naive to believe, but it's down here, okay? It's the amount of stress that you've put on your body and the neglect that you've done in amount of years. So yes, as you're older, you have more years of neglect potentially, but what about that 78-year-old that runs triathlons? Do you think he neglected his body? He's still able to do all that stuff. She's still able to do that stuff. Why? If it was age, every 40-year-old would feel a certain way. Every 50-year-old would feel a certain way. And some of you are like, yeah, all my friends feel that way. Yeah, well, look at what everyone does in your group. Do most people don't exercise and do that stuff to help their bodies recover? Or are your group of friends super active and making sure that they're not only active, but recovering from that? That's the big deal. It's recovery. So, I know I got a little bit off topic there, or I don't necessarily think it was off topic, but the matter at hand is this. When someone comes up to me and tells me, Dr. Mark, I'm afraid to see a chiropractor because I heard once you start going, you have to go for the rest of your life. There's a negative connotation to that. There's a negative thought process to that when really I believe, and again, I'm not saying you need to go to a chiropractor for the rest of your life, but I just don't like the negative thought process as to like, well, if that helped you, if stretching helped you, if therapy helped you, if that acupuncture helped you, why would you stop completely? Why would I just don't get that. Why are we not more proactive like we are with our teeth? Like we are with our weight goals when we achieve them and we're like, oh, we're just going to stop, and we think that, no, we know this to be true, that you have to be consistent and you have to keep some type of maintenance up to it. Same thing with your spine. I'd argue that your spine is the most important thing because it houses the one thing that functions everything in your entire body, and that's your spinal cord. Master controller up there needs to send the messages, people. So, I know this was a little bit long, but I hope you got a lot out of it. I hope that I helped. Again, I didn't want to make it a chiropractic thing, so I hope the examples that I gave kind of like made sense and that were at least congruent with like the same kind of topic and the same idea. But if you have questions, concerns, thoughts, anything, ask me. Post a question. I'm here to help you guys out. I want to talk more about this stuff because I think people are missing out on a remarkable, and this might be my bias, but a amazing therapy. I'm not going to say it's the be all say all. It's freaking awesome, okay? But I think people are missing out just because they feel like there's some kind of scam going on. Listen, we live in a world right now where if there's a scam going on, you don't just get to tell your mom and dad and maybe your friends, hey, don't go to that restaurant anymore, that's crap. You have social media. You can tell everybody about what's going on. I'm here to help you guys. I want to get you better. If you want to stick around and be a part of this and stay proactive and preventative about your health, fantastic. If you don't, I'm not going to say fantastic, but I'm not going to sit here and push you to do something you don't want to do either. So I'm here for you. If you leave me and things start to come back, I'm here for you when that happens too. So I hope you guys have an awesome day. The weather is getting better. The light, we're seeing it at the end of the tunnel. This is going to be awesome. Have a wonderful day. Talk to you guys later.